My name is Claire Liddy, and I'm a family doctor working here in Ottawa. I do clinical work over at the Ottawa Hospital Academic Family Health Team at the Riverside site, and I also do health services research based out of Briere Research Institute. One of the projects that I'm the most proud of really did start, though very small, and that is the Champlain e-consultation project. And that project is something that we've been working on. I worked with Dr. Erin Keeley, who's an endocrinologist, and we started working on that in 2008. And that project was really born out of a conversation that Erin and I had, which was about some of the issues that we deal with on wait times. So we were really just having a cup of coffee together, and I was complaining to her that, did you know it takes 6 or even 9 months for me to get a patient to come in for consultation at your clinic? And then she said, oh, I know, it's frustrating. And then she said, but did you know that a lot of the letters and a lot of the requests I get from family doctors are not very well described, and there's many cases that I see after people have waited that long where they probably just could have been managed by you if we'd been able to have a conversation about it. So just the ability for the two of us having a coffee together, that really identified what the problem was that we wanted to address. So it was really about trying to improve access to specialist care. And I certainly was feeling it on a day-to-day basis as a practicing family doctor. Worrying a lot about my patients who were sitting on waiting lists. I had very little information about whether or not they had their appointment, and worried about whether they were getting worse. And my patients would be calling me as well. And then from Erin's side, on the specialist side, she was frustrated by not being able to do anything about her wait list, and again had a feeling that some of the visits that people came to see her were potentially avoidable. So that's where the Champlain e-consultation project really was launched, just from that one conversation and identifying that we had a very common problem, and both of us were prepared to roll our sleeves up and really get to work on it and see what we could do.